Hello everyone, welcome to Demystifying Science. My name is Derek and today I will be explaining what Gaucher disease is. Gaucher disease is named after Dr. Philippe Gaucher, a French doctor who first described it in the late 1800s. It's a rare genetic disease caused by problems in lysosomes function. Inside our cells there are lysosomes. Think of lysosomes as the recycling centers of the cell. Their job is to break down fats and proteins so the body can reuse them or get rid of waste. Inside lysosomes, an important enzyme called glucocerebrosidase, or sometimes known as beta-glucosidase, helps break down a special fatty sugar molecule called glucocerebroside. Glucocerebroside is a glycolipid, meaning it contains both sugar and fat. It is found in cell membranes, especially in immune cells called macrophages, which help break down old and damaged cells like red and white blood cells. When these old cells are broken down, glucocerebroside is released and should be broken down inside lysosomes with the help of the enzyme. However, in people with Gaucher disease, there is a mistake in a gene called GBA, which acts like a recipe for making the enzyme glucocerebrosidase. Because of this mistake or mutation, the body either makes too little of the enzyme or makes one that doesn't work at all. Without enough of the enzyme, the body can't break down the fat molecule glucocerebroside properly. Instead of getting cleared out, it starts to build up inside lysosomes, especially in macrophages. These swollen, clogged up macrophages are called Gaucher cells, and they don't work the way they should. There are three different types of Gaucher disease. Type 1 of Gaucher disease is the most common form, making up about 90% of cases. It's often called the non-neuronopathic form because it typically does not affect the brain or nervous system. People with type 1 often experience the following symptoms: organ enlargement, defaulty Gaucher cells filled with fat build up in the liver and spleen. This makes these organs grow too big. This is the condition called hepatosplenomegaly. It can cause stomach pain, a feeling of fullness, and problems with how these organs work. Next is bone marrow issues. One of the most painful problems caused by Gaucher disease happens in the bones. Since bone marrow helps make blood cells, the buildup of Gaucher cells in the bone marrow can interfere with this process. Over time, this can lead to severe bone pain, also called bone crises, when there isn't enough blood flow to the bones. Osteoporosis, weakening of bones, making them more vulnerable to breaking. Bone infarctions, bone damage where parts of the bone die because they don't get enough blood. Type 2 Gaucher disease, also called acute neuronopathic Gaucher disease, is a much more severe form that affects infants. Since the missing enzyme affects the whole body, including the brain, babies with this condition often have serious neurological problems, such as weak muscles, trouble swallowing, developmental delays, seizures. Sadly, type 2 Gaucher disease is very serious, and most babies with these conditions do not survive past the first few years of life. Type 3 is an intermediate form, meaning it affects both the organs and the brain, but it progresses more slowly than type 2. People with type 3 may experience seizures, cognitive impairment, and difficulty with coordination. Even though type 3 is serious, many people with this form of the disease can live to become adults with proper medical care. Ever wondered how doctors figure out if someone has Gaucher disease? It's not as simple as a regular blood test. Let's break down the key medical techniques used to detect this rare genetic disorder. Step 1. The enzyme assay. Checking enzyme performance. Think of this like a performance test for beta-glucosidase, the enzyme that helps break down certain fats. Doctors take a blood sample and measure how active beta-glucosidase is. If the levels are significantly low, boom, that's a strong indicator of Gaucher disease. But to be absolutely sure, doctors turn to genetic testing. Doctors examine a person's DNA for mutations in the GBA gene, the genetic instruction manual for beta-glucosidase. If they find the mutation, another boom, diagnosis confirmed. Why does this matter? Knowing your genetic status can help families plan for the future. If both parents carry the bad gene, then there's a 25% chance their child could get the disease. Step 3. Looking for symptoms. Doctors also rely on physical signs of Gaucher disease like organ enlargement, bone pain, and blood cell deficiencies. If someone is frequently bruising, feeling tired, or experiencing chronic bone pain, that raises some red flags. Now let's discuss treatments. How do we manage symptoms? While there's no definitive cure for Gaucher disease, doctors have treatments that significantly improve symptoms to help patients live healthier lives. Let's dive into the three main treatment approaches. Enzyme Replacement Therapy, ERT. Doctors deliver lab-made beta-glucosidase through an IV infusion, usually every 2 weeks. This artificial enzyme works just like the natural one, breaking down the fatty molecule and preventing harmful buildup inside the cells. ERT is highly effective. However, it doesn't fix the genetic mutation that causes Gaucher disease. Patients need lifelong infusions to keep symptoms under control. Substrate Reduction Therapy. What if we could prevent glucocerebroside from accumulating in the first place? That's exactly what SRT does. Instead of adding an enzyme to break down glucocerebroside, SRT slows down its production using special oral medications. SRT is especially helpful for patients who can't tolerate ERT. For example, those who have severe allergic reactions to enzyme infusions. The limitations? SRT isn't for everyone. It's not suitable for all types of Gaucher disease, especially types 2 and 3. It also requires careful monitoring due to potential side effects, including digestive issues and liver problems. And finally, supportive care. In addition to targeted therapies like ERT and SRT, many patients need supportive care to manage symptoms that impact their daily life. For bone complications, doctors may recommend pain management or physical therapy. If blood-related symptoms, doctors might use iron supplements or blood transfusions. For patients with neuropathic Gaucher disease types 2 and 3, seizures can be a major concern. Neurologists often prescribe anticonvulsant medications to control them.
The bottom line, ERT is the gold standard for treating type 1 Gaucher disease. SRT helps patients who can't receive ERT but is not suitable for everyone. Supportive care improves quality of life by treating pain, bone issues, and neurological symptoms. New research like gene therapy aims to fix the disease at its source, bringing hope for even better treatments in the future. If you'd like to know more about the future of Gaucher disease treatments, check out the link attached below in the description.
That wraps up our discussion on Gaucher disease. If you found this video helpful, be sure to check out more content on the McMaster Demystifying Medicine channel. Thanks for watching.